There is a silent timer ticking inside every second man over 50. It is not your heart. It is not your brain. It is an organ you probably never think about, until it starts to ruin your life. If you think waking up 3 times a night is just part of aging, you are making a dangerous mistake. In this video, I'm going to show you the difference between a harmless nuisance and a silent killer. So please, stay with me. This is the manual for your body that no one ever gave you. Hello friends, welcome back to the channel. I am genuinely glad you are here with us today. Today, we are having a conversation that most men are too embarrassed to have. We are breaking the silence about the prostate. You know, in medical practice, there is a common observation. Men are often the most stubborn patients. We pride ourselves on being tough. We ignore back pain. We push through fatigue. And unfortunately, we apply that same stubbornness to our bathroom habits. For years, many of us tolerate incredible discomfort. We wake up multiple times a night. We stumble in the dark. We map out our road trips based on the location of the next rest stop. We stop drinking water after 6 p.m. just to get some sleep. We suffer in silence because of embarrassment. But beneath that silence, there is a sticky fear. A fear sitting in the back of our minds. A question we are too afraid to ask out loud. Is this just old age, or is it cancer? Today, we are going to clear the air. I want this video to be a turning point for you. We are going to break this down calmly and clearly. But first, we must understand the mechanics. We need to understand what exactly is happening inside your body when you turn 50. We're going to start with benign prostatic hyperplasia, or as it is commonly known, BPH. Let's look at the male body. To defeat an enemy, you have to know where he lives. Right in the center of the pelvis is the prostate gland. Poets and old-school doctors often call this the second heart of a man. It is not just a poetic metaphor. Like the heart, this organ works tirelessly. Physically, it is a gland about the size of a walnut, or maybe a chestnut. It sits deep in the pelvis. It is located directly below the bladder. It rests on the muscles of the pelvic floor. Behind it sits the rectum. This is why a doctor can feel the prostate during a physical exam. But what does it actually do? Its main job is reproductive. The prostate produces a special fluid. This fluid nourishes sperm. It gives them energy to swim. It protects them. Without a functioning prostate, natural reproduction is impossible. It also acts as a powerful valve. During intimacy, it shuts the bladder tight. This ensures that urine never mixes with biological fluid. However, this amazing organ has a fatal flaw in its design. Evolution placed the prostate in a very difficult position. It wraps tightly around the urethra. The urethra is the tube that carries urine out of the body. It wraps around it like a donut, or a dense ring. Imagine a garden hose with water flowing through it. Now imagine you slide a tight rubber ring over that hose. As long as the ring is soft, the water flows freely. But what happens if that ring starts to get thicker? What happens if it starts to squeeze inward? That is the root of the problem. The urethra runs through the prostate like a tunnel through a mountain. If the mountain shifts, the tunnel collapses. Now, here is the strange paradox. It baffles even scientists. Think about it. As we get older, most of our body shrinks. Our muscles get smaller. Our bones get thinner. Our skin loses volume. But the prostate does the exact opposite. It decides to grow. Why does this happen? The answer is hidden in your hormones. Your whole life, your body runs on testosterone. It is the fuel of masculinity. But inside the prostate cells, something changes. An enzyme converts testosterone into a much more potent substance. It is called dihydrotestosterone, or DHT. This powerful hormone acts like a fertilizer. It tells the prostate cells one thing: do not die. Keep growing. Multiply. In your 20s, cell growth and death are balanced. But after age 50, that balance shifts. Old cells don't die off. New cells keep appearing. This process is called hyperplasia. I want to be very clear here. This is not cancer. The cells are not broken. They are not aggressive. They are not trying to kill you. There are just too many of them. It usually starts in the inner part of the prostate, the part that touches the urine channel. It is like a crowded subway car. When more people get on, they start pushing against the walls. the prostate tissue expands. It begins to strangle the urinary channel. You might be thinking, I can live with a weak stream. But here is what they don't tell you. While you are living with it, your bladder is suffering. It is undergoing a transformation that cannot be reversed, even by surgery. This battle happens in 3 stages. Stage 1 is the compensation phase. The channel narrows slightly. The bladder realizes it has to work harder. It has to push the liquid out. So, like any muscle you exercise at the gym, the bladder wall gets thicker. It bulks up. At this stage, you might not notice much. Maybe the stream is a little slower. Maybe you have to wait a few seconds to start. Your body is compensating. It is fighting the blockage and winning. But then comes stage 2, the subcompensation phase. The bladder cannot pump iron forever. Eventually, the muscle gets tired. The walls lose their elasticity. Scar tissue begins to form between the muscle fibers. The bladder can no longer squeeze out every last drop. This is when residual urine appears. You go to the bathroom, you finish, but a few ounces of liquid remain trapped inside. This stagnant pool is a playground for bacteria. It leads to infections. It leads to bladder stones. This is when the symptoms start to ruin your day. And finally, stage 3, the decompensation phase. This is the stage we must avoid. The bladder stretches out like an old balloon. It becomes a flabby sac. It can hold a liter of urine, but it cannot squeeze a single drop out on its own. This leads to a scary condition called overflow incontinence. Urine leaks out uncontrollably because the tank is overflowing. Yet you cannot pee. This usually ends in the emergency room with a catheter. Let's get practical now. How does this translate into your daily life? I am going to list the 5 classic symptoms. I want you to count on your fingers. If you have more than 2 of these, listen carefully. Number 1 is the weak stream. Remember when you were 20? The stream was powerful. It had an arc. Now it feels like gravity is doing all the work. The stream falls vertically. Sometimes it hits your shoes. It is weak, thin, and disappointing. Number 2 is hesitancy. You stand at the urinal and you wait and wait. It takes 20 or 30 seconds to get the engine started. Some men have to run the sink faucet just to trigger the reflex. Number 3 is straining. You find yourself using your stomach muscles to push. Urination used to be a passive relief. Now it is a physical workout. Number 4 is intermittency. The flow isn't continuous. It starts. It stops. It starts again. This is the sign of a stuttering, exhausted bladder muscle. Number 5 is the sense of incomplete emptying. This is psychologically draining. You zip up your pants, you wash your hands, but before you even leave the restroom, you feel that heavy pressure again. You know you aren't empty. And finally, the king of all symptoms, nocturia. Waking up at night. Why does this happen? When you lay down flat to sleep, fluid from your legs moves back into your blood. Your kidneys filter it out, but your bladder is irritated by the prostate. It has shrunk in capacity. It screams to your brain, I am full, wake up. Getting up once a night at age 65 is normal, but 3 times? 4 times? Think about the cost. You never get into deep sleep. You wake up tired. Your blood pressure stays high because you aren't resting. You become irritable. And here is a statistic that is rarely talked about. For men over 70, rushing to the bathroom in the dark is dangerous. It is the #1 cause of falls and hip fractures. A prostate problem can literally break your bones. As we wrap up this first section, I need to address your mindset. Too many American men think this is just part of aging. They think, my dad had it, so I will just live with it. Friends, BPH does not fix itself. Without management, it only gets bigger. The blockage only gets tighter, but there is a dangerous myth that kills. Some men think if they have BPH, they can't get cancer, or they think their BPH will turn into cancer. Let's write this in stone. BPH is not cancer. It does not spread. It is benign. However, having an enlarged prostate does not protect you from cancer. You can have both conditions at the same time. Imagine a house with 2 bad tenants. One is the loud neighbor upstairs. That is BPH. He stomps around. He bangs on the pipes. He keeps you awake with urinary symptoms. The other tenant lives in the basement. He is quiet. You don't hear him. You don't see him. But he is lighting a fire in the foundation. That is cancer. The tragedy happens when a man assumes his problems are just the enlarged prostate. He treats the noisy neighbor. Meanwhile, the silent arsonist burns the house down. But here's the scary part. Prostate cancer usually doesn't hurt. It doesn't stop you from peeing. It hides. So, how do you catch a killer that leaves no fingerprints? In the next section, I am going to reveal the Golden Triad of diagnostics. And I will expose why the PSA test you rely on might be lying to you. Do not go anywhere. The next section could save your life. Welcome back. In the first part, we talked about the noisy neighbor. We talked about the enlarged prostate, or BPH, the one that wakes you up at night, the one that ruins your sleep. But now, we must turn on the lights in the basement. We need to talk about the silent tenant. We need to talk about prostate cancer. This is the part of the video that is difficult to hear, but it is the part that could save your life. If BPH is a nuisance, cancer is an assassin. It is a silent enemy that hides in plain sight. Let's define exactly what we are dealing with. Prostate cancer is a malignant tumor. This means the cells in the gland stop following the rules. They begin to divide uncontrollably. They lose their normal structure. And most terrifying of all, they acquire a new ability. The ability to travel. They can break away from the prostate. They can move into your lymph nodes. They can move into your bones. This is what doctors call metastasis. It is one of the most common cancers in men worldwide. But I have good news for you. It is also one of the most treatable cancers. But there is one condition. You have to catch it early. You have to catch it before it spreads. And that is where most men fail. Why do they fail? Because they rely on their feelings. They think, if I don't have pain, I am healthy. This logic works for a toothache. It works for a broken leg. But it does not work for prostate cancer. Let's look at the anatomy again. I want you to visualize the prostate like an orange. BPH, the benign growth, usually happens in the pulp, right in the center of the fruit. That is why it squeezes the juice channel so quickly. That is why you notice it. But cancer is different. In 70 to 80% of cases, cancer starts in the peel. It starts on the outer shell of the prostate. Doctors call this the peripheral zone. It is far away from the urinary tube. What does this mean for you? It means a tumor can grow there for years. It can get quite large, but it will not block your urine flow. You can pee perfectly fine. You can sleep through the night. You feel strong. You have no pain. But the cancer is there, growing quietly on the back wall of the gland. This is why waiting for symptoms is a deadly mistake. By the time prostate cancer causes symptoms, it is often too late. If you see blood in your urine, if you feel deep pain in your hips or back, if you suddenly cannot pee at all, these are often signs of stage 3 or stage 4. The cancer has already spread. We do not want to be there. We want to find it when it is just a tiny speck, when it is silent. So who is under the gun? Who needs to be watching this most carefully? We call these the risk factors. Factor number 1 is age. This is the engine of the disease. Prostate cancer in men under 40 is extremely rare. It is almost unheard of. But after 50, the risk starts to climb. After 65, the risk jumps significantly. If you are watching this and you are over 65, you are in the zone. Factor number 2 is race. This is a hard truth of biology. Statistics show that African American men have the highest risk in the world. Not only is the risk higher, the cancer tends to be more aggressive. It grows faster. If you are African American, you need to start checking earlier, usually at age 45. Asian men, on the other hand, have the lowest risk. White men fall somewhere in the middle. Factor number 3 is genetics. This is the family secret. Think back to your family tree. Did your father have prostate cancer? Did your brother have it? If a close male relative had it, your risk doubles. But here is something many people do not know. Look at the women in your family too. Did your mother or sister have breast cancer? Specifically, caused by the BRCA gene? We used to think this gene was only a female problem. We were wrong. A man can carry this gene too. And if you have it, your risk of aggressive prostate cancer skyrockets. So, ask your family. Dig into your history. It is not just polite conversation, it is medical intelligence. Factor number 4 is lifestyle. What do you eat? Where do you live? There is a reason prostate cancer is more common in the West, in America and Europe, and less common in rural Asia. It is the Western diet. High amounts of red meat, processed foods, animal fats, lack of vegetables, and most importantly, obesity. Fat tissue is not just dead weight. It is active. It produces hormones. It produces inflammation. This environment feeds the tumor. It acts like gasoline on a fire. Also, pay attention to vitamin D. Men who live in northern climates with less sun have a higher risk. So get outside, get some sun, or take your supplements. Let's bust a few myths before we move on. You will hear these at the barbershop or from your neighbors. Myth number 1. Prostate cancer is caused by having too much sex, or too little sex, or by having a vasectomy. Let me be clear. There is no strong scientific evidence for any of this. Your past romantic life is not to blame. Do not punish yourself with guilt. Myth number 2. If I have BPH, it will turn into cancer. We touched on this, but I will say it again. No. BPH tissue is different from cancer tissue. One does not morph into the other. But remember the house analogy. They can live together. Do not let the noise of BPH distract you from the silence of cancer. So, here is the million-dollar question. If you cannot feel it, if you cannot see it, if it doesn't hurt, and if you cannot rely on urinary symptoms, how on earth do we find it? How do we distinguish the innocent knot from the dangerous tumor? You cannot do it in front of a mirror. You cannot do it by checking how you feel. You need tools. You need the golden standard of diagnostics. In the next part of this video, I am going to walk you through the 3 steps: the blood, the finger, and the scan. And I'm going to tell you the truth about the PSA test. Many doctors interpret it wrong. A high number does not always mean cancer, and a low number does not always mean you are safe. I will teach you how to read the numbers like a pro. Get ready. We are moving from the problem to the solution. See you in the next part. Welcome back to part 3. We have arrived at the most practical part of our journey. We know the enemy can be silent. We know he can hide behind the mask of BPH, or he can hide in total silence. So, how do we catch him? How do we find the truth without cutting you open? In medicine, we have a strategy. It is called the Golden Triad of diagnostics. If you follow these 3 steps, the chance of missing a dangerous tumor is almost 0. But you have to do them in the right order, and you have to interpret them correctly. Most men stop after step 1, and that is where the mistakes happen. Step number 1, the blood test. We call it the PSA, prostate-specific antigen. You simply give a sample of blood from your vein. It is quick. It is painless. But the interpretation of this test is an art form. PSA is a protein. It is produced only by the prostate cells. Here is the most important thing you will learn today. PSA is organ-specific. It is not cancer-specific. What does this mean? It means a high level tells us something is happening in the prostate, but it does not tell us what. Imagine a smoke alarm going off in your kitchen. It could be a fire, but it could also be burnt toast. It could be steam from a boiling pot. The alarm sounds the same for all of them. That is your PSA. Traditionally, doctors looked at the number 4. If your PSA was under 4, you were safe. If it was over 4, you were in trouble. Today, we know it is not that simple. A man with a PSA of 2 can have a small, aggressive cancer. A man with a PSA of 8 can be perfectly healthy. Why does the number rise if it is not cancer? Reason number 1 is BPH. Remember our noisy neighbor? Large prostates produce more protein. If you have a big gland, your baseline PSA will be higher, and that is normal for you. Reason number 2 is inflammation. Prostatitis. If you have a cold or an infection, the PSA can jump to 10 or 20. Antibiotics will bring it back down. Reason number 3 is mechanical irritation. Did you ride a bicycle yesterday? The bike seat puts pressure on the perineum. Did you have sexual activity in the last 48 hours? Did the doctor perform a rectal exam right before the blood draw? All of these can falsely spike your numbers. So, rule number 1. Do not panic at a high number. Retest it after a few weeks of rest. But how do we know if it is cancer? Smart doctors look deeper. They look at PSA velocity. This is the speed of the rise. If your PSA was 1 last year and 1.2 this year, that is a slow, steady rise. Likely BPH. But if it was 1 last year and 2.5 this year, that is a rapid jump. That is a red flag. Even if the number is still low, the speed is dangerous. They also look at free PSA. PSA travels in the blood in 2 ways. Some acts alone, some is bound to other proteins. In cancer, the cells produce mostly bound PSA. So the amount of free PSA drops. If your free PSA is low, say below 10%, the risk of cancer is high. If your free PSA is high, say above 25%, it is likely just BPH. Ask your doctor about these ratios. Don't just ask for the total number. Step number 2. The digital rectal exam, the DRE. I know what you are thinking. I don't want to do that. It is embarrassing. It is uncomfortable. It hurts my dignity. I understand, but listen to me as a friend. These 10 seconds of awkwardness can save your life. Why is the blood test not enough? Because roughly 20% of prostate cancers produce very little PSA. The blood test will say, you are fine. But the finger will find the truth. Remember where cancer grows? On the peripheral zone. On the back wall. Right against the rectum. That is exactly where the doctor can feel. A healthy prostate feels like the tip of your nose. Soft, elastic, smooth. A prostate with BPH feels like your cheek when you puff it out. Big, round, but still soft. A prostate with cancer feels different. It feels like a knuckle or a stone, hard, irregular, fixed in place. If a doctor feels a hard nodule, it does not matter what the blood test says. You need to investigate further. Do not skip this step out of shyness. Doctors have done this thousands of times. It is just a diagnostic check. Step number 3. The visual scan. In the old days, if we suspected cancer, we went straight to biopsy. We poked needles blindly, hoping to hit the tumor. It was like playing darts in the dark. Today, we have changed the game. Before we touch you with a needle, we use an MRI. Specifically, a multi-parametric MRI with contrast. This is a powerful magnet. It creates a high-definition map of your gland. It can see the difference between normal tissue and tumor tissue. Radiologists use a scoring system called PI-RADS. It goes from 1 to 5. PI-RADS 1 means very likely normal. PI-RADS 5 means very likely cancer. If your MRI is clean, you might avoid a biopsy altogether. This technology has saved thousands of men from unnecessary procedures. But what if the MRI shows a dark spot? Then, and only then, do we move to the final step, the biopsy. This is the only way to be 100% sure. The word biopsy sounds scary, but modern medicine has refined it. We use a technique called fusion biopsy. We take the MRI map, we overlay it on a live ultrasound, like a GPS system for the needle. The doctor guides the needle precisely into the suspicious spot. They take tiny samples. It is done under local anesthesia, sometimes even sedation. You feel pressure, but rarely sharp pain. These samples go to a pathologist. They look under a microscope, and they give us the Gleason score. This score tells us how aggressive the cells are. Are they lazy and slow, or are they angry and fast? A Gleason 6 is usually slow. A Gleason 9 is very aggressive. This score determines everything that happens next. So, let's summarize the strategy. Once a year, you check your PSA. You let the doctor check physically. If something looks wrong, you get an MRI. If the MRI sees a spot, you get a biopsy. It is a logical path. It removes the guesswork. It removes the fear of the unknown. Knowledge is power, and in this case, knowledge is safety. Now, suppose the worst happens. Suppose the test comes back positive. Does it mean the end of your life? Does it mean major surgery? Does it mean the end of your potency? Not necessarily. In the final part of this video, we are going to talk about solutions. We will talk about the amazing technology of robotic surgery. We will talk about pills that shrink the prostate. And we will talk about foods that fight cancer. The diagnosis is not a verdict. It is just a problem to be solved. Join me in the final part. We are going to learn how to win this battle. Welcome back to the final part of our series. We have traveled a long road together. We explored the anatomy. We uncovered the symptoms. We learned how to find the enemy with tests. Now, we face the most important question of all. What do we do about it? If the doctor looks at you and says the word, whether it is BPH or cancer, does life end there? Absolutely not. In fact, we are living in the golden age of urology. The treatments we have today are miracles compared to 20 years ago. Let's start with the noisy neighbor. Let's talk about treating BPH. If your symptoms are mild, if you wake up once a night, and the stream is just a little slow, the doctor might suggest watchful waiting. This means we do not attack yet. We simply change your habits. You stop drinking coffee after lunch. You avoid alcohol before bed. You double void. That means you pee, wait a minute, and try again. You would be amazed how much these simple tricks help. But if the symptoms are stealing your life, if you cannot sit through a movie, if you are tired all the time, we move to medication. We have two main weapons. Weapon number one is alpha blockers. Think of these as the door openers. They relax the tight muscles around the neck of the bladder. Within a few days, the tension drops, the door opens, and the flow returns. It is almost like magic. Weapon number two is 5-alpha reductase inhibitors. Think of these as the shrinkers. They block the hormone DHT. They slowly starve the prostate tissue. Over 6 months, the gland actually gets smaller. Often, doctors combine these two pills for the best effect. But what if pills are not enough? What if the blockage is total? Then we move to surgery. And please erase the picture of scary scalpels from your mind. Modern BPH surgery is done without a single cut on your skin. The gold standard is called TURP, transurethral resection of the prostate. The doctor inserts a tiny instrument through the natural channel. It has a camera and a loop. He gently shaves away the excess tissue from the inside. Remember the orange? He scoops out the pulp but leaves the peel intact. The channel becomes wide and open again. Men who have this surgery often say they feel 20 years younger. We also use lasers now. Green light laser, HoLEP. These turn the tissue into vapor. There is almost no bleeding. You go home the next day, so do not fear the intervention. Fear the suffering. Now, let's talk about the heavier topic. Treating prostate cancer. If the biopsy comes back positive, take a deep breath. Do not rush. Prostate cancer is rarely an emergency. You have time to think. You have time to get a second opinion. The treatment depends entirely on the aggression of the tumor. Remember the Gleason score? If the score is low, say Gleason 6, and the tumor is small, and you are older, perhaps over 75, we might choose active surveillance. This is a revolutionary approach. We know that low-grade prostate cancer grows incredibly slowly. It might take 15 years to cause trouble. If you are 75, the treatment might be worse than the disease. Why risk side effects if the cancer will never hurt you? So we watch it like a hawk. We test PSA every 3 months. We do MRIs. If it stays asleep, we let it sleep. Many men live out their natural lives with cancer, but never die from it. But what if the cancer is aggressive? What if you are young and fit? Then we must remove it. We go for the cure. Option number 1 is surgery. Radical prostatectomy. We remove the entire gland. Today in the US, this is almost always done by a robot. The Da Vinci surgical system. The surgeon sits at a console. He controls robotic arms with microscopic precision. The robot can see nerves that the human eye cannot. This is crucial, because right next to the prostate run the nerves that control erections, and the muscles that control urine. A skilled robotic surgeon can spare these nerves. He can save your potency. He can save your continence. Recovery is fast. Option number 2 is radiation. We use high-energy beams to kill the cancer cells right where they sit. Or brachytherapy, where we implant tiny radioactive seeds inside the prostate. Both surgery and radiation have high cure rates, over 90% for early stages. The choice depends on your preference and your body. Finally, let's talk about what you can do. Is there a way to prevent this? Can we eat our way to health? We cannot change our genes, but we can change the environment they live in. Your prostate loves lycopene. This is a red pigment found in tomatoes. But here's the trick. Raw tomatoes are okay, but cooked tomatoes are medicine. Tomato paste, tomato sauce, stewed tomatoes. Heat releases the lycopene so your body can absorb it. Eat them with a little olive oil. Cruciferous vegetables are also key. Broccoli, cauliflower. They contain compounds that fight cancer cells. Cut down on the red meat. Cut down on the charred BBQ. And move your body. Your prostate sits in the lowest part of your torso. Blood tends to stagnate there. Walking, swimming, and squatting improve circulation. Fresh blood brings immune cells to fight the tumor. And one last delicate question. Is sexual activity good or bad? Studies suggest that regular ejaculation is beneficial. It drains the gland. It prevents fluids from becoming stagnant and inflamed. So yes, maintain your love life. It is good for your heart. And it is good for your prostate. We have reached the end of our guide. If you take only one thing from this video, let it be this. Silence is your enemy. Action is your friend. The prostate is just a part of your body. It is not a taboo. It is not a source of shame. It is a biological machine that needs maintenance. Do not wait for pain. Do not wait for blood. Make a deal with yourself today. Call your doctor. Schedule that annual checkup. Ask for the PSA test. And do not be afraid of the finger exam. Those few minutes of prevention give you years of peace of mind. Think about your family. Think about the people who love you. They want you around for a long time. They want you healthy. They want you strong. Take control of your health. You are the driver of this vehicle. Do not ignore the check engine light. Thank you for watching. Thank you for trusting me with your time. If this video helped you understand your body better, please help us. Hit the like button, subscribe to the channel, and share this video with a friend who needs to hear it. You might just save a life today. Stay healthy, stay strong, and I will see you in the next video.